Over the next 10 years, I think public health research is going to continue to attack the big problems that face mankind. And we're going to do it by integrating basic science, behavioral science, epidemiology, all the facets of public health to make real inroads into improvement of human health. I'm Michael J. Klag, Dean of the Bloomberg School of Public Health.
And I'm Brian Simpson, editor of Johns Hopkins Public Health magazine. Dean Klag, thank you for talking with us today about the public health research in the new decade.
My pleasure.
Let's begin. What are some of the most important trends in public health research for the next 10 years?
Well, I think that's a big question. Public health is a broad field. One of the problems we have in explaining ourselves to the outside world is the heterogeneity of disciplines that we bring together to attack public health threats. But I would say that we're going to see more and more interdisciplinary research that takes people from the laboratory, from health policy, from behavioral interventions, from epidemiology, and working more and more together to attack the problems that face all mankind.
Mm-hmm. And is that sort of breaking out of the silos that may have existed in the past?
Well, I think silos aren't as much a problem in public health because by nature, if you attack big problems, you have to work together. And we have always accepted a broad range of disciplines because of the history of public health. But I think, yes, for what silos exist, I think the membranes between expertise will become more and more porous, and people will work together even more.
Mm-hmm. And what should schools of public health be doing to meet these challenges in the future?
Well, I think, what do schools of public health do? Number one, we produce leaders. We need to continue to do that. There is a dearth of people with public health experience. We know that in the U.S. alone, if you look at public health practice, we need another 250,000 people to be working in health agencies and be adding that expertise. So we're starting way behind where we should be. So we need to continue to educate folks who are going to become the leaders in public health, who are going to work in academia, who are going to work in industry, who are going to work for NGOs and public health agencies. So that's number one. Number two is we need to continue to build the bridges between our schools and engineering and medicine to look at the big issues of the day and the new issues that we create as a race. For example, if you look at nanobiotechnology, this is a field that didn't exist a decade ago, but we now know that we can produce these very tiny substances which may have great effects in terms of prevention of disease or treatment, but also create hazards in terms of toxicity. So looking at problems like that that require multiple disciplines, I think is going to become increasingly important.
Mm-hmm. And when we look at some of the big infectious diseases mm-hmm. like TB, malaria, and HIV, decades of research have yet to produce the magic bullet for these and other infectious diseases. Why is that?
Well, I don't know if I agree with that. Certainly for HIV, we don't have a magic bullet. And we're an instance where you have an infection and develop no immunity to the wild type infection. You can imagine it's a very difficult problem to develop a magic bullet and to develop something that increases immunity when none exists in the wild type. So HIV is a special case. But if you look at TB or malaria, we've had great advances in therapy of those. And what's happened is that we haven't been able to take those therapies and institute effective control programs. The problems there are some scientific issues, but the major problems are lack of effective programs, usually because there's problems with lack of or government taking responsibility for the health of its people. So the problem hasn't been lack of effective therapies, it's been implementation of those therapies. And in fact, for TB, as you know, the big problems we face now were created because there were effective therapies that were misused.
And would you say that the great challenge is on the intervention side of things for public health in the future and making effective interventions, or on the research side?
Well, Brian, I think both are important. I spent my career doing research. I think that having a vigorous, aggressive research agenda is critical to improving the health of human populations. We don't know what we don't know, by definition. However, that said, there are many things we do know that we do not implement well, and understanding how preventive interventions can be implemented better how they can be implemented at the individual level and the community level. These are key areas that we need to improve. And for many diseases, we have effective preventive interventions that aren't used optimally.
Mm-hmm. And turning back to research, what areas do you see the greatest research breakthroughs coming in the next 10 years?
Well, if I knew that, I would be selling stocks and not being dean. But I think it's clear that understanding more about how the environment and behavior interacts with the human genome is going to be important. So epigenetic mechanisms of gene silencing, understanding how they happen in populations, that's going to be critical. I think understanding how we prevent chronic disease better. We know a fair amount about in high-risk individuals, secondary prevention, some primary prevention, but we have a world of work to do in understanding how we do a better job of implementing what we know about science, about disease risks to prevent hypertension, to prevent diabetes. We know how to do that well in individuals. How we develop population approaches is a key question. We need to work on that. And that can have a tremendous impact. As you know, chronic diseases are the leading cause of death in the world, and it's only going to grow. We need to develop the scientific basis for prevention at the population level. We have some information. We have a long way to go. And I think there'll be great impact when we do.
Mm-hmm. A lot of people think when they think research, they just think of what goes on in the laboratories, mm-hmm. but it's actually a lot of behavioral research and mm-hmm. social research mm-hmm. is important too, is what you're saying.
Certainly understanding what happens in the laboratory is important, but even when we know that, unless we can translate that to the community, we're not going to have an impact on the burden of disease. And so understanding implementation, how we implement interventions, how we take what works at the individual level and scale that up to cost-effective public health approaches where an individual may never be touched or counseled, but because of the policies in that society, because of the environment, their health is protected. That's what we need to know. There are so many new exposures now. For example, if we just take the issue of environmental health in our water and in our foods that we don't understand the health implications of. We need research to understand those implications, and then once we discover the risks, we need to figure out how to prevent exposure.
When we think about climate change and emerging viruses, bioterrorism and other future threats, there's plenty of reasons to worry about the future. Do you spend a lot of time doing that, or are you more optimistic?
I feel optimistic about the future, and part of it is because I interact with so many young people and not so young people at our school who make you feel good about the future of the human race. If you go back to the 60s and the 70s and you see the predictions of where we're going to be now in terms of food insecurity, in terms of war, we actually have done a good job. We have more to do. We need to focus on family planning and unmet needs there, and knowing that population growth underlies a lot of the public health problems. We need to focus on all these issues. But certainly, I feel very optimistic about the future. We have more people going into public health now than ever before. We have more people attending schools of public health. We have more schools of public health. I think people are recognizing the big issues and are inspired to take them on. So I feel good about the future.
Dean Klag, thank you very much for talking with us today.
My pleasure, Brian.